Hi, friend. This is Dr. Apurv Mehra, and I'll come to two things which have been asked the most for the guidance of picking up a seat. The scenarios have started. Number one, surgical branches have a long learning curve, but friends, do you also know that this difficulty of surgical branches is usually in the initial year when you're younger? Let's take a practical situation. At the age of 23, 24, or 25, you take a postgraduate seat. You are young, you're full of energy. Yes, surgical wards are heavier. But then you acquire your skills and you prepare for MCH or you stay as a general surgeon. And when you go ahead, you go for SRship. Yes, it's difficult to get. And then you specialize into those areas which you wanted to do. Getting a fellowship, yes, it's a little tough, and then establishing your practices into a college, like into a place like Delhi. The metros is tough, into the periphery is relatively easier, agreed. But as you go down the line after 8 to 10 years, which is an average time that a surgeon takes to settle down, please understand that your time becomes of immense value. You will be operating cases, and your results will be evident. You will be conducting OPDs. Your clinical experience will be enriched. And as it keeps on going, your team will keep on grow and your work is distributed. So by the time you reach 40, 41, you will be practically working more efficiently, and possibly you can just decide, draw a line that this is what I want to make out of my practice, both as the number of patients, the clinical outcomes, and money, and draw a line and stick to it, and their life is relatively easier and simple as compared to the branches which do not have interventions. So the thought is not absolutely correct that just don't take a surgical branch if you want a cool life. If you look at a spectrum, when you actually are growing up or you are at a 40s, you have relatively stability if you are somebody who can be satisfied with what you're doing. And then, if you're looking for any branch and it is a branch of your choice, then this video is not applicable. But just don't rule out a surgical branch just because you see that in the initial years there is more hard work. There is hard work in every branch. The second question that is asked to me is there a branch superior to the next branch? No. One of my closest friends, Dr. Gobind Raigar, always says that दम बंदे में होता है branch में नहीं. And that's, I think that summarizes medical education system, because you have to be intentionally focused on what you're doing. So intentionally means your intentions towards your branch has and your patients has to be very good, and you have to focus and take good steps to build your career. And if you're ready to learn forever, you will keep on growing. So whatever branch it is, do not just go with the norms that this is a good branch or a bad branch or top branch or not top branch. If you like it, you're getting it, take it. Third, does the place of the college matter a lot? Yes, it does. And if you are comparing the top colleges, you can consider into, and you are into your own city, and consider these factors: that are you at your house doing your post graduation, and if there is a marked difference between the colleges which are in your hometown and the big names that you know in the country, do not hesitate to go to the big name, because education is something that you should not be hesitant to travel for, right? This is one thing which is very, very important. Then if I have not decided what branch should I take, people who are not specifically towards the end branches, they take up medicine or surgery, and this keeps all the options open. But you have to take a decision: are you a surgeon or are you a physician or the medical guy? These two differences are usually clear in minds. And then going towards it, if you're not decided, you can just go for general medicine or general surgery and keep your options open. And then the big question is, I'll sum this video with this question. I am a female. Should I take a surgical branch or not? The root cause of this question is in the teaching that we have in our system. We have been told to glorify the princess, and the princess, the lady, right, as compared to a prince, has always been shown weak and more of beauty oriented. So in the wars, the kings and the prince will fight, and the beauty is waiting in the fort. Now this, when you show that the female gender in the stories is not that strong, you know then you somehow keep learning it, and when you grow as a doctor, you have a thought that this particular branch or this surgical branch is for males or the other one is for females. This is the problem in the root of the education. Why don't we remember the story of Rani Lakshmibai? Why don't we remember the story of the wives of the army men who have shown courage in different parts of the life? And why don't we remember those ladies are leading in the front and everywhere? Why in medical branch there is this thought? And remember, friend, the world is changing very quick. Now you have the females picking up this all the surgical branches, and I just pray that I don't have to make a video like this. And in fact, making a video like this is demeaning the main purpose for which this video has been created. Please do not let your genders stop you from taking what you want. A male can very well take a gynae ops. A female can be an orthopedician or a general surgeon. Choose what you want. Forget about what people say, because लोग तो कहेंगे क्योंकि उनका काम है कहना. And this is what I want to talk about in this video, with a summary of whatever questions were put on the YouTube to me. But if you have more questions, keep pouring down. I will be getting the answers. Thank you very much.